Lavender is commonly used for anxiety, stress, and insomnia. It's also been used for depression, dementia, pain after surgery, and many other conditions. Most often it's used as an aromatherapy oil, or it's even used as flowers inside a pillow to help sleep. Many are unaware of its use internally. Existing pharmacotherapies for anxiety disorder are limited by the delay to the therapeutic effect, dependence, tolerance, withdrawal, or abuse potential. Therefore, safe and effective based complementary or alternative therapies may be important allies in the care of patients with anxiety disorder. Lavender essential oil has an extensive anecdotal history of anxiolytic benefit and has been recently supported by clinical efficacy trials. The two primary terpenoid constituents of lavender essential oil, linalool and linalool acetate, produce the anxiolytic effect in combination via the inhibition of voltage-gated calcium channels, a reduction of the 5-HT1A receptor activity, and increased parasympathetic tone. In mice, a standardized lavender oil was used along with diazepam, pregabalin, and other essential oil-based terpenes as active controls to investigate the pharmacodynamic properties. Interestingly, the standardized lavender oil lacked appreciable affinity for serotonin, norepinephrine, or dopamine reuptake transporters, as well as the monoamine oxidase A or the GABA receptors. This suggests that a new novel mechanism compared with traditional anxiolytic therapies exists for lavender. A randomized, blinded, placebo-controlled crossover trial in 17 healthy human volunteers investigated the brain changes that were detectable by positron emission tomography and magnetic resonance imaging scanning after administering 8 weeks of standardized lavender oil at 160 milligrams per day. The investigators focused on the inhibitory 5-HT1A receptor because of increases in activity of this receptor being highlighted in the pathophysiology of anxiety in previous neuroimaging studies. They found reduced binding potential at the 5-HT1A receptor in the hippocampus and the anterior cingulate cortex in the lavender oil group when compared with the placebo. This has also been demonstrated after administration of the drug escitalopram in patients with anxiety. The authors postulate the reductions in the 5-HT1A receptor activity may be a commonality in the anxiolytic efficacy of various interventions, and that lavender oil acts via this mechanism. Additional to the central effects, lavender oil appears to have peripheral effects that may be important to its mechanism of action. Lavender oil has displayed increased parasympathetic activity as well as decreased hemodynamic parameters in rats, dogs, and humans. These effects may help to alleviate somatic symptoms of anxiety that are characterized by autonomic arousal. Lavender essential oil has been granted generally recognized as safe status by the FDA. This means that it's safe when used for its intended purposes as a food additive, whereas many other essential oils are inappropriate for oral administration in their undiluted form because of the irritant, inflammatory, or cytotoxic effects on the skin, and especially on the mucous membranes. So lavender oil product exhibits many desirable properties of an anxiolytic agent, including a calming effect without sedation, as well as a lack of dependence, tolerance, or withdrawal. It's important to use a product that contains a correct dose of 80 milligrams of lavender oil per day, prepared for human consumption with the correct extraction methods. 3 clinical trials were identified which investigated the efficacy of oral lavender oil preparation that was administered once daily at the dose of 80 milligrams per day in subsyndromal mixed anxiety disorder and generalized anxiety disorder, as well as in restlessness and agitation. The anxiolytic effect of lavender was superior to the placebo in 221 patients who were suffering from anxiety disorder. In addition, lavender improved associated symptoms such as the restlessness, disturbed sleep, and the somatic complaints, and it had a beneficial influence on general well-being and the quality of life. In line with this study, the efficacy of a 6-week intake of oral lavender oil preparation compared to lorazepam, and it was investigated in adults with generalized anxiety disorder. The study indicates that lavender efficiently ameliorates generalized anxiety comparable to 0.5 mg per day of lorazepam. Alleviation of anxiety and mood improvement were reported in 36 patients who were admitted to an intensive care unit who received lavender oil aromatherapy. The same results were reported for 14 female patients who were being treated with chronic hemodialysis. A survey in a long-stay neurology inpatient department also showed increased mood scores and reduced psychological distress following the aromatherapy with lavender when accompanied with tea tree and rosemary. An investigation on the effects of lavender aromatherapy on anxiety and depression in the high-risk postpartum women showed a significant improvement at the Edinburgh Postnatal Depression Scale and the Generalized Anxiety Disorder Scale after 4 consecutive weeks of administration of the lavender. As there's many possible benefits to consuming lavender, and it may help to reduce depression and anxiety, it's no wonder so many people are trying this natural remedy over pharmaceutical drugs that can come with numerous side effects. Check out my other video on novel treatments for anxiety disorder for more possible alternatives to prescription drugs.